Welcome to the Kentucky Health Information Exchange, also known as KHIE. This video provides an overview of KHIE's case report entry functionality in the ePartner viewer. In this video, I will demonstrate how to create an attending physician/clinician and person completing form details, and how to complete an acute hepatitis B case report in the ePartner viewer. There are 9 different types of case report forms in the ePartner viewer. However, this video will only cover how to complete an acute hepatitis B case report. You can follow this video as guidance for all case reports. To view directions for a specific case report, please navigate to the ePartner Viewer Resources section, or the KHIE website to view detailed training guides for each of the 9 case report forms. Please note that all examples in this video are simulated with mock data and no protected health information is present. To start using the case report entry functionality, log into the ePartner viewer and click the Case Report Entry tab in the blue navigation bar at the top of the screen. The Case Report Entry tab drop-down menu includes the following options. The Case Report Forms option lists the different types of case reports. The Case Report Entry User Summary displays all submitted and in-progress case reports. Manage User Preferences offers an efficient way to enter repetitive data, such as interviewer, attending physician/clinician, person completing form, and ordering provider/clinician details. The Case Report Forms drop-down menu includes the following case report types: COVID-19, sexually transmitted diseases, multi-drug resistant organism, other reportable conditions, and hepatitis case report forms. The Hepatitis Case Report Forms sub-drop-down menu includes perinatal hepatitis, child hepatitis, and acute hepatitis case report forms. The Acute Hepatitis Case Report Forms sub-drop-down menu includes hepatitis A, B, and C. The Manage User Preferences option provides an efficient method for you to include pertinent details that would allow you to quickly select an interviewer, attending physician/clinician, person completing form, and ordering provider/clinician from drop-down menu options, instead of manually entering these details with each case report entry. The purpose of setting these preferences is because there are certain details that will be used multiple times and in multiple case reports. These drop-down menus are located on the patient information screen. Please note that this video will only cover how to create an attending physician/clinician and person completing form details, which are used for all other case report forms. Prior to entering your case report form, you are required to enter details about your attending physician/clinician and person completing form on the Manage User Preferences screens. To create an attending physician/clinician, click the Case Report Entry tab in the blue navigation bar at the top of the screen. From the Case Report Entry drop-down menu, select Manage User Preferences. Select Create Attending Physician/Clinician Details. To create an attending physician/clinician, enter the provider details in the mandatory fields marked with asterisks. If known, select the appropriate prefix from the drop-down. Enter the attending physician/clinician's first name and last name. If known, select the appropriate suffix from the drop-down. Enter the attending physician/clinician's address, city, state, and zip code in the appropriate fields. Enter the attending physician/clinician's phone number and email address. After completing the mandatory fields, click Save. The Create Attending Physician/Clinician pop-up displays to show that the information entered has been saved successfully. Click OK to proceed to the View and Edit Attending Physician/Clinician Details screen. To edit an attending physician/clinician's details, click the Edit icon located next to the appropriate attending physician/clinician. In the Update Attending Physician/Clinician Details pop-up, you can edit the appropriate fields. When finished, click Save to save the updates. Then, click OK to close out of the pop-up. To delete an attending physician/clinician from the user preferences, click the trash bin icon located next to the appropriate physician/clinician. To delete the attending physician/clinician, click OK. Click Cancel if you do not want to delete the attending physician/clinician. To search for a specific attending physician/clinician in the user preferences, click Apply Filter. Search by entering the attending physician/clinician's name, email address or phone number in the corresponding filter fields. Now that the attending physician/clinician has been created, let's create the person completing form details. To enter details about the person completing the form, click the Case Report Entry tab located in the blue navigation bar at the top of the screen. Select Manage User Preferences. Then, select Create Person Completing Form Details. The Create Person Completing Form Details screen displays. Enter the details about the person completing the form in the mandatory fields marked with asterisks. If known, select the appropriate prefix from the drop-down. Enter the first name and last name of the person completing the form. If known, select the appropriate suffix from the drop-down. Enter the address, city, state, and zip code in the appropriate fields. Enter the phone number and email address of the person completing the form. After completing the mandatory fields, click Save. The Create Person Completing Form Details pop-up displays. Click OK on the pop-up to proceed to the View and Edit Person Completing Form Details screen. The View and Edit Person Completing Form Details screen functions the same way as the View and Edit Attending Physician/Clinician Details screen. To edit the details for the person completing the form, click the Edit icon located next to the appropriate person. In the Update Person Completing Form Details pop-up, you can edit the appropriate fields. When finished, click Save to save the updates. Then, click OK to close out of the pop-up. To delete details for a person completing the form from the user preferences, click the trash bin icon located next to the appropriate person. To delete, click OK. Click Cancel if you don't want to delete the person completing the form. To search for a specific person completing form in the user preferences, click Apply Filter. Search by entering the name, email address, or phone number of the person completing the form in the corresponding filter fields. Now that we've created an attending physician/clinician and person completing form details, let's create a case report for hepatitis B. Before starting the case report, please review these tips for manually entering case report data. There are mandatory fields marked with red asterisks. These fields must be completed in order to proceed. In addition to completing the mandatory fields, please enter as much information as possible. Help icons are available to help guide you while entering data in the fields. The Save button allows you to complete the case report form in multiple sessions. That means you can start a case report form, save it, and then return later to continue the case report where you left off in the previous session. You must save the information you have entered in order to return later to the section where you left off. All case report forms have conditional questions, which are questions asked based on your response to the previous question. Based on the answer selected for conditional questions, certain subsequent fields on the screen will be enabled or grayed out and disabled. For example, if you select No for the conditional question at the top of the laboratory information screen, the subsequent fields will be grayed out and disabled. If you select Yes to the conditional question, the subsequent laboratory-related fields are enabled. Additionally, if No or Unknown is selected for certain conditional questions, the screen will be disabled and the subsequent fields will be marked as No or Unknown. For example, if you select No or Unknown to the conditional question at the top of the applicable symptoms screen, all subsequent fields will be disabled and labeled as No or Unknown. The Acute Hepatitis B Case Report Form is an 8-step process where users enter patient information, laboratory information, applicable symptoms, exposure information, hospitalization, ICU, and death information, vaccination history, and additional comments. The final step is the Review and Submit screen where users must review the information they have entered and submit the case report. To start, click the Case Report Entry tab in the blue navigation bar at the top of the screen. Select Case Report Forms from the drop-down menu. Then select Hepatitis Case Report Forms. Click Acute Hepatitis Case Report Forms. And finally, select hepatitis B. The first section of the acute hepatitis B case report form is the patient information screen. Enter the date of diagnosis. If the date of diagnosis is unknown, click the unknown checkbox. Select the appropriate answer for the conditional question. Is the affiliation organization same for patient ID, MRN, person completing form and attending physician/clinician? Click yes to apply the same affiliation organization to the patient ID, MRN, the person completing the form, and the attending physician/clinician. Click no to select a different affiliation organization for the patient ID, MRN, person completing form, and the attending physician/clinician. Enter the patient's medical record number. An MRN is an organization-specific, unique identification number assigned to a patient. If your organization does not use an MRN, you must create a way to uniquely identify your patient so that the patient is registered in KHIE. Select the affiliation/organization that applies to the patient ID, MRN. Please note that if yes is selected for the conditional field, then the same affiliation organization will apply to each. Select the name of the person completing form from the drop-down menu. If the appropriate name does not display in the drop-down, you must click the person completing form hyperlink to create details for a new person. The person completing form pop-up displays. Complete the mandatory fields marked with asterisks. If available, select the appropriate prefix from the drop-down menu. Enter the first name and last name of the person completing the form. If available, select the appropriate suffix from the drop-down menu. Enter the appropriate address, city, state, and zip code. Enter the phone number and email address of the person completing the form. After completing the mandatory fields, click Save. Upon saving, the person completing form drop-down is automatically updated with the new name of the person completing form. If applicable, select the affiliation/organization that applies to the person completing the form. If Other is selected, the subsequent field is enabled. Enter the name of the organization associated with the person completing the form in the subsequent text box. If Other, please specify. Select the attending physician/clinician. If the appropriate name does not display, you must click the attending physician/clinician hyperlink to create details for a new attending physician/clinician. This hyperlink functions the same way as the person completing form hyperlink. Select the attending physician/clinician from the drop-down menu. If applicable, select the affiliation/organization that applies to the physician attending the patient. If available, select the prefix and suffix from the drop-down menus. Enter the patient's first name and last name. If available, enter the patient's middle name. Enter the patient's date of birth. Select the patient's sex from the drop-down menu. Select the patient's ethnicity and race from the drop-down menus. Enter the patient's street address, city, state, zip code, and county. Enter the patient's phone number. If available, enter the patient's email address. Select the appropriate visit type from the Visit Type field drop-down menu. Please note that the Encounter ID/visit number hyperlink allows users to view the patient case history pop-up, which displays the historical case report details and encounter IDs previously submitted for the patient, based on the entered patient first name, last name, and patient ID, MRN. If you click the Encounter ID/visit number hyperlink, but did not complete the first name, last name, and patient ID, MRN, fields, the patient case history pop-up will display the following message. To view the patient case history, you must enter a valid patient first name, last name, and patient ID, MRN, on the patient information screen. If the entered patient first name, last name, and patient ID, MRN, are not associated with any previously submitted case reports and encounter IDs, the patient case history pop-up will display the following message: there is no data to be displayed. Click the Encounter ID/visit number hyperlink to view the patient's case report history based on the patient first name, patient last name, and patient ID, MRN, that have been entered. If there are historical case reports associated with the entered patient first name, patient last name, and patient ID, MRN, the patient case history pop-up displays the creation date time, report name, condition name, visit type, and the encounter ID from case reports previously submitted for the patient. By default, the patient case history pop-up sorts the list of case reports by date with the most recent date displaying first. To view the patient case history details in a different order or in alphabetical order, click the sorting buttons to the right of each column title. To search for a specific case report previously submitted for the patient, click Apply Filter. Search by selecting the creation date time range from the drop-down menu. You can also search by entering the report name, condition name, visit type, or the encounter ID in the appropriate filter fields. To close out of the patient case history pop-up, click OK. If known, enter the unique encounter ID/visit number in the encounter ID/visit number field, which allows you to enter up to 20 digits. If the encounter ID/visit number is unknown, click the Generate checkbox to create a unique system-generated 20-digit encounter ID/visit number. Upon clicking the Generate checkbox, the encounter ID/visit number field will be grayed out and disabled. The disabled encounter ID/visit number field will not display the system-generated encounter ID/visit number until the user completes all the required fields on the patient information screen and clicks Save. This confirms the encounter ID/visit number, allowing the user to proceed to the next screen. If applicable, select the appropriate answer for Is the patient currently pregnant? If Yes is selected, the subsequent field is enabled. Enter the estimated due date in the subsequent field. If unknown, click the Unknown checkbox. Select the appropriate answer to prior hepatitis B diagnosis. If Yes is selected, the subsequent field is enabled. Enter the date of diagnosis in the subsequent field. If unknown, click the Unknown checkbox. Once the patient information screen is complete, click Save. Upon clicking Save, the patient information pop-up displays the following message. Please note that you will not be able to change/update encounter ID/visit number after you save this screen or proceed to the next screen. Click Yes on the pop-up to confirm the encounter ID/visit number. Upon clicking Yes on the patient information pop-up, the system-generated encounter ID/visit number will display in the disabled encounter ID/visit number field. The Generate checkbox is also disabled. Click Next to proceed to the laboratory information screen. On the laboratory information screen, select the appropriate answer for the conditional question, Does the patient have a lab test? If Yes is selected, the subsequent lab fields are enabled. Select the appropriate hepatitis marker from the drop-down menu. Select the appropriate test result from the Results drop-down menu. If applicable, enter the viral load in the text box field. If applicable, enter the test result date. Enter the specimen collection date. Please note that the specimen collection date must occur on the same date or any date before the test result date. Enter the laboratory name in the text box. You can click Add Hepatitis Marker to log the details for multiple hepatitis markers on the same patient. To delete an additional hepatitis marker, click the trash bin icon located at the top right. You can click Add ALT to log the details for an ALT. To log details for an AST, you can click Add AST. You can also click Add bilirubin to log the details for bilirubin. To delete ALT, AST, or bilirubin details, click the trash bin icon at the top right. Once the laboratory information screen is complete, click Next to proceed to the applicable symptoms screen. On the applicable symptoms screen, select the appropriate answer for the conditional question at the top, or symptoms present during the course of illness. Enter the onset date for the symptoms. If unknown, click the Unknown checkbox. To report if the patient had a fever, select the appropriate answer for the fever field. If yes, enter the patient's highest temperature in the subsequent text box field. To report if the patient had diarrhea during the illness, select the appropriate answer for the diarrhea field. If yes, enter the number of days of diarrhea in the subsequent text box field. If the patient is symptomatic for acute hepatitis B, select the appropriate answers for the remaining fields to indicate the symptoms the patient experienced during illness. Please note that the symptoms vary based on the case report type. To report additional symptoms not listed on the screen, select the appropriate answer for the field. Did the patient have any other symptoms? If yes is selected, the subsequent field is enabled. Enter the patient's other symptoms in the subsequent text box. Once complete, click Next to proceed to the exposure information screen. On the exposure information screen, select the appropriate answer for the conditional question at the top. Did the patient have any of the following exposures in the past 6 months? Select the appropriate answer for the domestic travel, outside state of normal residence, field. If yes, select the state that the patient traveled to, from the subsequent drop-down menu. Enter the date of departure and the date of arrival in the appropriate fields. If the date is unknown, click the Unknown checkbox. You can click the Add Domestic Travel button to log the dates of travel for multiple domestic trips. This means you can enter additional states that the patient has traveled to in the past 6 months. To delete additional domestic travel details, click the trash bin icon at the top right of the section. Select the appropriate answer for the international travel field. If yes, select the country that the patient traveled to, from the subsequent drop-down menu. If yes, please specify country. Enter the date of departure and the date of arrival in the appropriate fields. You can click Add International Travel to log the dates of travel for multiple international trips to enter additional countries that the patient has traveled to in the past 6 months. To delete additional international travel details, click the trash bin icon. Select the appropriate answer for the cruise or vessel travel as passenger or crew member field. If yes, enter the name of the cruise ship in the subsequent text box field. If yes, please specify cruise ship. Enter the date of departure and the date of arrival in the appropriate fields. You can click Add Cruise or Vessel Travel to log the dates of travel for multiple cruise or vessel trips where the patient traveled as a passenger or crew member in the past 6 months. To delete an additional cruise or vessel travel section, click the trash bin icon. Please note that the next several questions are conditional fields that can enable the subsequent text box fields based on the selected answer. If yes is selected for the conditional field, then the subsequent text box field is enabled. The user must enter the appropriate details in the enabled, if yes, please specify, text box field. Select the appropriate answer for the field. Is the workplace critical infrastructure, for example, healthcare setting or grocery store? If yes is selected, the subsequent field is enabled. Enter the name of the workplace setting in the subsequent text box. Select the appropriate answer for the field, adult congregate living facility, nursing, assisted living or long-term care facility. If yes is selected, enter the name of the adult congregate living facility in the enabled text box. Select the appropriate answer for the school/daycare field. If yes is selected, enter the name of the school/daycare in the enabled text box. Select the appropriate answer for the correctional facility field. If yes is selected, enter the name of the correctional facility in the enabled text box. Select the appropriate answer for the known contact with same diagnosis or similar symptoms field. If yes is selected, the subsequent fields are enabled. Enter the patient's relationship to the contact in the subsequent text box. If yes, please specify the relationship. Enter the contact's first and last name and contact information in the subsequent text box. Select the appropriate answer for the incarceration field. If yes is selected, the subsequent fields are enabled. Enter the patient's incarceration details in the first text box. Enter the patient's history of incarceration in the second text box. Select the appropriate answer for the foreign-born field. If yes is selected, the subsequent field is enabled. Select the country that the patient was born in from the subsequent drop-down menu. Select the appropriate answer for the IV drug use field. If yes is selected, the subsequent field is enabled. Enter the patient's IV drug use details in the subsequent text box. Select the appropriate answer for the other illicit drug use field. If yes is selected, the subsequent field is enabled. Enter the patient's other illicit drug use details in the subsequent text box. Select the appropriate answer for the exposure to hepatitis B virus field. Select the appropriate answer for the tattoos field. If yes is selected, the subsequent field is enabled. Select the setting of the tattoo from the subsequent drop-down menu. If other is selected from the drop-down menu, the subsequent field is enabled. Enter the setting of the tattoo in the subsequent text box. If other, please specify. select the appropriate answer for the piercings field. If yes is selected, the subsequent field is enabled. Select the setting of the piercing from the subsequent drop-down menu. If other is selected from the drop-down menu, the subsequent field is enabled. Enter the setting of the piercing in the subsequent text box. If other, please specify. Select the appropriate answer for the needle stick injuries field. If yes is selected, the subsequent field is enabled. Select the locations on the body where the needle stick injury occurred from the multi-select drop-down menu. If the patient has any needle stick injuries, please specify the location on the body. If other is selected from the drop-down menu, the subsequent field is enabled. Enter the locations on the body where the needle stick injury occurred in the subsequent text box. If other, please specify. Select the appropriate answer for the recent sexual contact field. If yes is selected, the subsequent field is enabled. Select the number of sexual partners from the subsequent drop-down menu. If yes, please specify number of sexual partners. Select the appropriate answer for the field. Is this part of an outbreak? If yes is selected, the subsequent field is enabled. Enter the name of the outbreak in the subsequent text box. Once complete, click Next to proceed to the hospitalization, ICU, and death information screen. On the hospitalization, ICU and death information screen, select the appropriate answer for the conditional question at the top. Was the patient hospitalized? If yes is selected for the conditional question, the subsequent hospitalization-related fields and ICU-related fields on the screen are enabled. If the patient has been hospitalized, enter the name of the hospital where the patient is hospitalized, or was hospitalized in the text box. If yes, please specify the hospital name. Enter the patient's hospitalization admission date. Enter the patient's hospitalization discharge date. If the patient is still hospitalized, click the Still Hospitalized checkbox. If the Still Hospitalized checkbox is selected, the subsequent death-related field is disabled. Did the patient die as a result of this illness? Select the appropriate answer for the field. Was the patient admitted to an intensive care unit, ICU? If yes is selected, the subsequent fields are enabled. Enter the admission date to ICU and the discharge date from ICU in the appropriate fields. If applicable, select the appropriate answer for the field. Did the patient die as a result of this illness? If yes is selected, the subsequent is enabled. Enter the patient's date of death in the subsequent field. Once complete, click Next to proceed to the vaccination history screen. On the vaccination history screen, select the appropriate answer for the conditional question at the top. Has the patient ever received a hepatitis B vaccine? If yes is selected for the conditional question, the subsequent fields are enabled. Select the appropriate vaccine name from the subsequent drop-down menu. If yes, please provide vaccine name. If other is selected, the subsequent field is enabled. Enter the vaccine name in the subsequent text box. If other, please specify. Select the number of doses that the patient received for the selected vaccine from the drop-down menu. If yes, please enter the number of doses. If 1 is selected as the number of doses, the date administered first dose field is enabled. Enter the date that the first dose was administered. If 2 is selected as the number of doses, the date administered first dose and date administered second dose fields are enabled. If 3 is selected as the number of doses, the date administered first dose, date administered second dose, and date administered third dose fields are enabled. If 4 is selected as the number of doses, all 4 of the date administered fields are enabled. Enter the date that each vaccine dose was administered based on the selected number of doses. If the date is unknown, click the Unknown checkbox. You can click Add Vaccine to log the details for multiple vaccines. To delete an additional vaccine, click the trash bin icon located at the top right of the section. Once complete, click Next to proceed to the Additional Comments screen. On the Additional Comments screen, enter additional notes about the patient if applicable. Once complete, click Next to proceed to the Review and Submit screen. The Review and Submit screen displays a summary of the information you have entered. Before submitting the case report, review this screen to verify its accuracy. You can click Print to print the case report. Upon clicking Print, a print preview pop-up will display for you to review before printing the case report. You can click Download to download a PDF version of the completed case report. Once the download is complete, a pop-up will display. Click OK to close out of the pop-up. To view the downloaded case report, click the PDF icon at the bottom left. A PDF of the case report will display in a separate tab. You can click the download icon at the top right to download the PDF to your computer. Start by reviewing the patient information section for accuracy. You can click the header of any section to hide or display the details for that section. Review the laboratory information section. Then review the applicable symptoms section. Review the exposure information section. Review the hospitalization, ICU, and death information section. If applicable, review the vaccination history and additional comments sections. If changes are required, click the section header hyperlink to navigate to the appropriate screen to edit the information. Upon clicking the vaccination history hyperlink in the section header, you will be navigated to the vaccination history screen. Make the appropriate edits on the screen. Once the appropriate edits are completed, click Next, or click the Review and Submit tab. The Save Changes pop-up displays. Click Yes Save to save the edits. You will be navigated back to the Review and Submit screen. Review your edits on the Review and Submit screen to verify that the information is accurate and the appropriate changes have been made. After verifying the information is accurate, click Submit to submit the acute hepatitis B case report. Please note that all case report submissions are final. Click Cancel to continue reviewing the case report. Click the Submit button to submit the case report entry. Click OK on the pop-up when the case report entry has been submitted successfully. Clicking OK when the case report entry has been submitted will automatically navigate you to the case report entry user summary screen. The case report entry user summary screen displays all submitted and in-progress case reports you have entered. By default, the case report entry user summary screen displays the case reports from the last updated date. You can use the date range buttons to do a custom search for previous case reports entered within the last 6 months. To search for a specific case report, click Apply Filter. To review a summary of a complete case report that has been previously submitted, click the View button next to the appropriate case report. The Case Report Details pop-up displays a summary of the previously submitted case report. You have the option to print or download a PDF of the case report. Click OK to close out of the pop-up. The Copy button allows users to copy the information from a previously submitted case report into a new case report, update the appropriate details, then submit a new case report for the same patient. Clicking Copy will automatically navigate you to the patient information screen of the copied case report. By default, the patient information screen displays the information entered on the previously submitted acute hepatitis B case report. Users can change the information entered in any of the enabled fields and submit a new acute hepatitis B case report for the same patient. However, users cannot change the disease/organism and date of diagnosis, or the affiliation organization, patient demographic fields, or the visit type and encounter ID/visit number because these fields are grayed out and disabled. The disease/organism, date of diagnosis, affiliation organization, patient demographic fields, visit type, and encounter ID/visit number fields are the only disabled fields in the copied case report. All other fields on the patient information screen and all subsequent screens are enabled and can be edited. Once the appropriate edits have been made, click Next to proceed to the laboratory information screen. On each subsequent screen, all fields are enabled. Edit the appropriate enabled fields, as applicable. Once the appropriate edits have been made on the subsequent screens, click Next until you navigate back to the Review and Submit screen. After verifying the appropriate changes have been made, you must click Submit to submit the copied case report. Please note that this is a new case report, and is not a continuation of the previously submitted case report for the patient. Once successfully submitted, the case report entry pop-up displays. Click OK to navigate to the case report entry summary screen. On the Case Report Entry User Summary screen, review the new case report submission copied from the previously submitted case report for the same patient. The Save feature allows users to start a case entry, save it, and then return later to complete the section where you left off. To continue working on an in-progress case report that you started and saved previously, click Continue next to the appropriate case report. Clicking Continue automatically navigates you to the section of the case report where you left off after clicking the Save button. You can complete the rest of the case report and submit. Congratulations! You have submitted an acute hepatitis B case report using KHIE's case report entry functionality. For additional training resources, such as the direct data entry for case reports user guides, please visit the KHIE website at khie.ky.gov. Thank you for watching this demonstration.